Can a 40-year-old male patient with chronic low back pain improve significantly without any type of surgery, without long-term medicine, and without bed rest? Yes, definitely we can cure this patient with the help of yoga. Friends, here I am discussing a case of lumbar spondylosis with you and how a well-structured yoga protocol helps that patient to relieve his pains and improves completely him from the lumbar spondylosis within only 6 weeks. Let us first understand what lumbar spondylosis is. Actually, lumbar spondylosis is a degenerative disease in which lower spinal vertebrae, associated ligaments, paraspinal muscles, and intervertebral disc got degenerated. This typically seen in the patients having prolonged sitting habits. So, over the time, 4 changes are seen in that patient. First one is the paraspinal muscles got into spasm. Then the associated ligaments become stiff. Then the disc between the vertebrae got dehydrated and the vertebrae changed their normal shape and the osteophytes are erupted. A male 40-year-old IT professional patient came into my clinic last week. He has lower back dull aching pains also sometimes radiating to the buttocks and to the legs, and lower back get stiffed particularly in the morning. The MRI of that patient shows lumbar spondylosis at L4 and L5 level. At this patient, should we go for aggressive stretching? The answer is clearly no. We should focus on 4 things. The first one is spinal muscle extension. The second one is we should go for core muscle stabilization. Then third is paraspinal muscle strengthening. And the last one and very important is nerve relaxation. So instead of random yoga, I prescribed a well-structured yoga protocol in which I choose 5 yogic practices to that patient. The first one is the Makarasana, that is crocodile pose. Crocodile pose helps to relieve lumbar pressure on the nerves and it also relaxes the muscles in the lower back area. Here we introduce second asana, that is a Bhujangasana. But here we choose Ardha Bhujangasana, that is only 50% raising of upper body. Because control extension relieves flexion dominance of the spine and this also gives strength to the back muscles. In order to give strength to the hip muscle, gluteal and hamstring muscle, next we incorporate Ardha Shalabhasana in this protocol. Ardha Shalabhasana also gives strength to the spinal muscle and it improves spinal stability. Only spinal support is insufficient. We also require core abdominal muscle and back muscle strengthening, which we got from Setubandhasana. Setubandhasana also reduces pressure on the lumbar spinal segment and it also gives stability to our pelvic region. A chronic pain is not of purely mechanical origin. It also has a neurological component. So we introduce Nadi Shodhana, that is alternate nostril breathing in this, which reduces pain perception at central nervous system. After continuous practice for 3 weeks, weekly 5 days in a week, the pain reduced by 50% and morning stiffness reduced significantly. After 6 weeks of the continuous practice, the pain and morning stiffness reduced completely and posture awareness is also improved. So in this case, chronic back pain relieved by a well-structured yoga protocol in which we use Makarasana, Bhujangasana, Ardha Shalabhasana, Setubandhasana and Nadi Shodhana Pranayama. If you want to hear more case studies like this, subscribe our channel Clinical Yogi. Thank you very much for watching till the end.